As we age, our bodies speak to us in subtler ways. Sometimes it's a twinge, a flicker of discomfort, or an itch that doesn't seem to go away. What may start as a minor annoyance can be a messenger of something more serious. For older adults, paying attention to the signals our skin sends can mean the difference between early detection and dangerous delays. Today, we begin a vital conversation about the 5 itchy areas seniors must not ignore because your health is too precious to gamble with. 1. The scalp, when a persistent itch means more than dry skin. Let's start at the top, literally with the scalp. Now it's easy to dismiss an itchy scalp as a nuisance. Maybe it's the shampoo. Maybe the air is dry. But if you're over 60 and your scalp constantly itches, even after switching products or moisturizing, it could be something much more important. And this is where paying attention, rather than brushing it off, might just save you from bigger problems down the road. A persistently itchy scalp can signal several underlying conditions, some of which are common as we age, and others which warrant a doctor's immediate attention. One of the most frequent culprits is seborrheic dermatitis, a chronic skin condition that causes scaly patches, redness, and itching. Often confused with dandruff, it's more severe and tends to flare up in cold weather or during times of stress. It doesn't go away with over-the-counter shampoos alone and may require medicated treatments prescribed by a dermatologist. But there's another reason this area matters. Your scalp can be a hiding place for skin cancer, particularly basal cell carcinoma or squamous cell carcinoma. These aren't always obvious. Sometimes they appear as flaky patches or slightly raised areas that feel itchy, sore, or bleed easily. Because most of us don't look at our scalp every day, and because the itch may not feel severe, these early signs often go unnoticed until the condition has progressed. Seniors, especially those who have spent a lot of time outdoors over the years, should be especially vigilant. Sun damage from decades past can now resurface as something serious. Another hidden threat? Psoriasis, which causes intense itching, silvery scales, and inflammation. Psoriasis is an autoimmune condition that can show up for the first time later in life. It's not just a skin issue, it's also linked to arthritis, depression, and cardiovascular problems. Left untreated, psoriasis can spread and deeply impact quality of life. And then there's the possibility of lice or mites, which, while more common in children, can affect seniors too, particularly those in communal living situations like assisted living or nursing homes. The social stigma often causes delay in seeking help, but it's important to treat infestations quickly to avoid spreading them or developing skin infections. Lastly, let's not forget drug reactions. Many older adults are on multiple medications, and itching can be a side effect. If you've recently started or changed a medication and your scalp suddenly becomes irritated, don't assume it's coincidence. Your body may be trying to tell you it's not tolerating something well. So what should you do if your scalp just won't stop itching? Inspect the area regularly or ask a loved one or caregiver to check for red patches, scabs, or unusual spots. Don't ignore flaky skin that doesn't respond to dandruff shampoo. Note patterns. Does it worsen at night? After taking certain medications? In cold or dry weather? These details help a doctor make a proper diagnosis. See a dermatologist if it persists for more than 2 weeks, especially if over-the-counter solutions haven't worked. Protect your scalp from the sun even if you have hair. Wear a wide-brimmed hat and use sunscreen sprays made for the scalp when spending time outdoors. Remember, your scalp is skin too, and it's just as vulnerable to aging, illness, and sun damage as any other part of your body. Listening to its signals can help you prevent discomfort, detect disease early, and feel more comfortable in your skin, quite literally. 2. The lower legs, when itchy skin signals circulation trouble or something deeper. Now let's move down the body to the lower legs. It's a familiar feeling for many older adults, an itch that sneaks in right around the ankles or shins. It starts subtly, a dry patch here, a scratch there. At first, you might chalk it up to dry air, a wool sock, or maybe even an allergy. But when that itching becomes persistent, disruptive, or is joined by other changes, it's time to pause. Because in older adults, chronic itchiness on the lower legs can signal more than just dry skin. It might be your body whispering about deeper issues, especially with your circulation, nerves, or kidneys. Let's start with one of the most common causes, xerosis or excessively dry skin. As we age, the skin naturally produces less oil, especially on the lower legs. The result? Skin that feels tight, flaky, and irritated and itches constantly, especially at night or after a warm bath. If left untreated, this dryness can lead to painful cracking, increased risk of infection, or even the development of eczema, a chronic inflammatory condition that can take months to calm once triggered. But dry skin isn't the only player here. For seniors, persistent itching in the legs, especially if it's accompanied by swelling, discoloration, or changes in temperature, may signal poor circulation. Conditions like chronic venous insufficiency are surprisingly common but often go unnoticed in the early stages. With this condition, the veins in your legs struggle to return blood back to your heart, causing it to pool around the ankles and calves. This poor circulation can lead to fluid buildup, skin changes, and a distinct itching or burning sensation that won't go away with lotions or creams. You might also notice varicose veins, a heavy or tired feeling in the legs, or a reddish-brown discoloration around the ankles, all signs that your circulatory system needs attention. The itching isn't just a surface issue, it's your body trying to relieve discomfort caused by deeper internal pressure and inflammation. In some cases, that itch may even be neurological, tied to peripheral neuropathy, a common condition in seniors, especially those with diabetes. This is when damaged nerves begin to misfire, sending itching, tingling, or even burning signals that have no visible cause on the skin's surface. What you're feeling isn't dryness, it's a nerve trying to send a message. Then there's kidney disease, often overlooked as a cause of leg itching. The kidneys play a crucial role in filtering waste from the body. When they begin to decline, toxins can build up in the bloodstream, causing systemic symptoms like fatigue, swelling, and yes, relentless itching, often on the legs and back. It might not be your first thought when your skin itches, but if you also notice changes in urination, appetite, or energy levels, it's worth discussing with your doctor. Let's not forget medications. Many older adults are managing multiple prescriptions, and drug interactions or side effects can lead to itching, especially on the lower extremities, where circulation and sensitivity often change with age. So, what can you do if your lower legs won't stop itching? Moisturize regularly, not just when it feels dry. Use thick, fragrance-free creams or ointments, especially after showering when the skin is still damp. Lotions often aren't enough. Elevate your legs daily, especially if you notice swelling or aching. This helps blood flow back to the heart and reduces pooling that can irritate the skin. Avoid hot baths or harsh soaps, which strip away natural oils. Use lukewarm water and gentle, moisturizing cleansers instead. Check for visible changes, redness, dryness, swelling, varicose veins, or ulcers. These are important clues and should be evaluated by a doctor. Get your circulation assessed, especially if you have a history of diabetes, high blood pressure, or heart issues. As for lab work, if the itch persists without a visible cause, simple blood tests can check kidney and liver function, glucose levels, and more. Here's the bottom line: an itchy lower leg isn't always a simple skin issue. In the aging body, it might be the surface signal of a deeper imbalance, whether in your veins, nerves, or internal organs. And because early symptoms are often subtle, your willingness to notice, track, and speak up could make a powerful difference in your long-term health. So the next time you find yourself scratching your shin in frustration, don't ignore it. Ask, what's my body trying to tell me today? 3. The back. That unreachable itch could be more than skin deep. The back, perhaps the most neglected real estate on the human body. It's the place we struggle to reach, to see, to treat. And yet, it's one of the most common spots where older adults report persistent itching. Sometimes it feels like a tickle beneath the shoulder blades or a rough patch just out of reach. You might rub against a door frame or use a back scratcher to get relief, thinking it's nothing but dry skin. But here's the truth: when your back itches frequently, especially without an obvious rash, your body might be alerting you to something deeper and potentially more serious. Let's begin with the obvious suspect: dry skin, also called xerosis. As we age, the sebaceous glands that once produced nourishing oils slow down. Combine this with long, hot showers or harsh soaps, and the skin along your spine and shoulders becomes dry, tight, and maddeningly itchy. But this type of itch usually improves with thick moisturizers, humidifiers, or lifestyle changes. So if you've tried all the basics, moisturizing, switching soaps, changing detergents, and your back still itches relentlessly, especially at night or during rest, we need to look deeper. One often overlooked cause in older adults is brachioradial pruritus. This condition produces an intense, sometimes burning itch, usually on the upper back, neck, or arms. It's caused not by the skin itself, but by nerve irritation, typically related to cervical spine degeneration. In simple terms, as the bones and discs in your neck age and compress, they can pinch nearby nerves. That pressure doesn't cause pain, it causes itch. And unfortunately, the itch can be severe. People describe it as maddening, like a deep crawling under the skin that never fully goes away. Lotion won't touch it. Only targeted treatment for the nerves can bring relief. Similarly, postherpetic neuralgia, a nerve condition that follows shingles, can cause lingering itch on the back, especially in the area where the shingles rash once appeared. Even after the rash fades, the nerves remain hypersensitive. Itching, tingling, or burning may continue for months or even years. Another cause? Notalgia paresthetica, a name that might sound foreign but refers to a surprisingly common itch on the mid to upper back, usually between the shoulder blades. It feels like you always need someone to scratch that one spot. Again, the cause is often nerve compression or irritation, not skin disease. The muscles around the spine and shoulders press on tiny sensory nerves, triggering chronic itching. This condition often worsens with poor posture or a sedentary lifestyle, something that becomes more common with age. And then there's liver disease, a silent and dangerous culprit. One of the early signs of liver dysfunction is itching, often starting on the back. The reason? When the liver struggles to process bile, waste products build up in the bloodstream. One of these substances, bilirubin, irritates the nerves beneath the skin. This form of itch doesn't come with a rash. It simply lingers, deep, unrelenting, and often worst at night. If your itch is accompanied by fatigue, yellowing of the eyes, or dark urine, this could point toward a liver issue that needs urgent attention. Let's not forget about skin cancers. The back, particularly in individuals who've spent years in the sun, is a prime location for basal cell carcinoma, squamous cell carcinoma, and even melanoma. These cancers can start as small, itchy patches or bumps that flake, crust, or bleed slightly. Because we can't easily see our own backs, changes often go unnoticed until someone else points them out, or the itching becomes relentless. So what can you do if your back is constantly itchy? Use mirrors or ask for help. Have someone examine your back regularly. Look for moles, bumps, or areas of discoloration. Track the itch. Is it worse at certain times of day? Is it always in the same spot? Does anything relieve it or make it worse? Moisturize thoroughly using rich, fragrance-free creams. Apply immediately after bathing, focusing on those hard-to-reach areas. Use tools if needed. Consider posture and movement, especially if your itch aligns with stiffness in the neck or back. Gentle stretches or physical therapy may ease nerve pressure. Request a spinal evaluation if you suspect nerve-related itch. An MRI or CT scan may reveal compression that needs treatment. Ask your doctor about liver function tests, particularly if the itch is deep, comes without rash, and is worse at night. Don't wait to biopsy if there's a suspicious lesion or scaly patch. Early detection is everything. Here's the takeaway. The back may be out of sight, but it should never be out of mind. That persistent itch might not be just dry skin. It could be your spine, your liver, your nerves, or something on the surface that demands attention. So the next time you find yourself twisting or reaching for a back scratcher, don't just settle for relief. Ask yourself, what's behind this itch? What's my body trying to tell me that I can't quite reach on my own? For the feet, that itch could be a silent warning sign. We now reach the base of the body, the feet. Humble, often hidden, but essential. For older adults, the feet are more than just a means of getting from one place to another. They are quiet messengers of your overall health. And when they itch, especially without an obvious cause, they may be trying to tell you something urgent. It's easy to dismiss foot itch as a minor problem. Perhaps it's just dry skin or the socks were too warm. Maybe it's just athlete's foot, something you remember from your younger years. But persistent itching on the feet in older adults deserves a closer look, because it could signal infection, nerve dysfunction, circulation problems, or even systemic illness. Let's begin with the most common culprit, fungal infections, especially tinea pedis, also known as athlete's foot. It thrives in warm, moist environments, and for feet that spend most of the day enclosed in socks and shoes, that's an ideal breeding ground. In seniors, skin becomes thinner and immune response is slow, making it easier for fungi to invade. The result? A maddening itch, often between the toes or along the arch, sometimes accompanied by redness, scaling, or burning sensation. Now, the good news: athlete's foot is treatable. But the not-so-good news? Left unchecked, it can crack the skin, making way for bacterial infections, and in seniors, that's where the real danger lies. A small break in the skin, especially for those with diabetes, can open the door to cellulitis or even more severe complications. That's why even a minor foot itch deserves your full attention. Speaking of diabetes, one of the more serious causes of itchy feet in older adults is diabetic neuropathy. This condition affects the nerves, particularly in the extremities. It often begins subtly, tingling, numbness, or an odd itching that doesn't seem to have a visible source. Over time, this can progress to burning pain, loss of sensation, and poor wound healing. Diabetic neuropathy is more than uncomfortable. It's dangerous. Without full feeling in the feet, a person might not notice cuts, blisters, or infections until they've worsened. That's why every itch, especially one that's persistent or paired with changes in sensation, should be taken seriously. And then there's circulation. The feet, being the farthest point from the heart, are often the first to suffer from poor blood flow. Itching in the feet can sometimes signal peripheral artery disease, PAD, a condition where narrowed arteries reduce blood flow to the limbs. It might feel like a deep itch or a throbbing in the soles and toes, often made worse by walking or standing. You might also notice cold feet, color changes, or hair loss on your legs. But what if there's no rash, no obvious skin problem, and your circulation seems fine? It could be a sign of systemic illness, such as kidney or liver disease, both of which can cause generalized itching that often starts or intensifies in the lower extremities. In these cases, the skin may look completely normal, but the discomfort is real, and your internal organs may be signaling distress. There are also contact allergies to consider. Seniors often develop sensitivities to detergents, materials, or even certain insoles and socks that can lead to itching, redness, or peeling skin. The feet, enclosed, warm, and often overlooked, are vulnerable to these hidden irritants. So what should you do if your feet won't stop itching? Inspect your feet daily, especially if you have diabetes or circulation issues. Use a mirror or ask someone to help you check for blisters, cracks, or sores. Wash and dry thoroughly, especially between the toes. Trapped moisture is a fungal playground. Use antifungal powder or cream if you notice peeling or redness. But if it doesn't improve within a week, see a doctor. Moisturize with care. Apply lotion to dry areas, but avoid the spaces between the toes to prevent fungal overgrowth. Wear breathable footwear and change your socks daily. Cotton or moisture-wicking materials work best. Avoid scratching, it damages the skin, making infection more likely. Use cold compresses or topical treatments for relief. Talk to your doctor about testing, especially if you have diabetes, kidney issues, or a history of poor circulation. A simple checkup could prevent serious complications. Your feet carry the weight of your life. And when they itch, they're not just asking for comfort, they may be warning you about deeper imbalances. The earlier you respond, the better your chances of maintaining mobility, independence, and overall well-being. So the next time your foot itches in the quiet of the evening, pause. Don't just scratch and forget. Ask, is this a small irritation or a small symptom of something I can still change? 5. The groin and inner thigh area, when itching is more than a private problem. Now let's talk about one of the most sensitive and often most silently endured, places where seniors may experience itching: the groin and inner thighs. It's a place few people want to talk about. Yet, it's one of the most common areas where persistent itching occurs, especially as we age. And because it feels personal, even embarrassing, many older adults suffer in silence. But the truth is, groin itching isn't just uncomfortable. It could be a signal from your body that something needs attention. Something important. Let's begin with the most frequent culprit: intertrigo. This is a rash that forms in skin folds, especially where skin touches skin and moisture builds up. The groin, inner thighs, and lower abdomen become vulnerable as the skin naturally thins with age. Sweating, friction from movement, and tight clothing can all contribute. The result? A raw, red, intensely itchy or burning sensation that may crack, weep, or even become infected if not addressed promptly. Then there's tinea cruris, more commonly known as jock itch. Though often associated with athletes, jock itch can affect anyone, particularly seniors, whose immune systems may not fight off fungal infections as easily as before. This fungal rash thrives in warm, moist environments and tends to appear as a ring-shaped, itchy area that spreads outward. Left untreated, it can persist for weeks or months, and it spreads easily through clothing, towels, or shared bedding. But not every itch in the groin is a fungus. Contact dermatitis is another major player, and in seniors, it often sneaks in through new soaps, laundry detergents, creams, or even materials in undergarments. As skin becomes more reactive with age, the groin is especially susceptible. The reaction might be subtle at first: a bit of redness, a little tingling, but over time, it can escalate into intense itching and inflammation. If you're using a new product and the itching starts soon after, that's a clue worth exploring. There's also a more complex condition known as lichen sclerosis, a chronic inflammatory skin disorder that often appears in the genital area of older adults, particularly postmenopausal women. It causes white patches of thinning skin, often with extreme itching or pain. Left untreated, it can lead to scarring or, in rare cases, increase the risk of certain types of cancer. It's a condition that demands medical evaluation and ongoing care. Another concern, especially in older men, is prolonged itch without rash. This may point to neurological causes, such as nerve compression in the spine. The itch may feel deep and impossible to relieve, often worse at night or when sitting for long periods. This is more than a skin issue, it's a signal from the nervous system that something deeper may be misfiring. And we can't overlook the role of urinary incontinence or leakage, which affects many seniors. Even minor accidents can lead to moisture in the groin area, and over time, that moisture creates a perfect environment for bacterial or yeast infections. These infections not only cause itching but can lead to skin breakdown or open sores if not treated early. So how can older adults manage and, more importantly, prevent groin itching? Practice daily hygiene. Gently cleanse the area with warm water and a mild, fragrance-free cleanser. Avoid scrubbing, which can damage fragile skin. Keep the area dry, pat, don't rub, and allow time for the area to air out after bathing. Use a clean, dry towel between folds if necessary. Wear breathable, loose-fitting clothing. Natural fibers like cotton help wick away moisture. Avoid synthetic underwear or pants that cause friction. Use barrier creams or powders if moisture is a problem, especially with incontinence. Zinc oxide-based creams and antifungal powders can help create a protective layer. Watch for persistent changes, like white patches, thickened skin, cracking, or lesions that don't heal. These warrant a visit to a dermatologist or gynecologist/urologist. Stay hydrated and support skin health from the inside out. Proper hydration and a nutrient-rich diet contribute to stronger, more resilient skin. Don't delay medical care out of embarrassment. Your doctor has seen it all. And the sooner you address it, the better your chances of preventing infection or long-term complications. The groin may be a private area, but it should never be ignored. In fact, the discomfort you feel there, though it may be something you'd rather not mention, could be your body's way of saying, "Please don't overlook me. I need care too." You deserve to feel clean, comfortable, and confident, not just from the outside in, but from the inside out. And if that itch keeps returning, let it be a reminder. Even the quietest discomforts can carry the loudest truths about your health. That brings us to the end of our journey through 5 of the most commonly itchy and commonly overlooked areas that deserve your attention. But before we close, let me ask you this. Which of these 5 areas spoke to you the most today? And have you ever experienced an itch you now suspect was trying to tell you something deeper? If this video helped you understand your body better, or reminded you to look a little closer at those everyday annoyances, please consider subscribing to the channel and giving this video a like. It helps more people like you find practical, compassionate guidance for aging well and living fully.